how do you know if you've actually got high hamstring tendinopathy? Now, doctors or physios, regardless of whether you see them in a clinic or actually online, will make the diagnosis in 3 ways. The first is they will have an in-depth conversation, because depending on what you say your symptoms feel like, how they act to different activities, etc., that can give us a big suspicion of whether this is hamstring tendinopathy or not. And I'll walk through that in a minute. Then the second is you have to combine that with movement tests, because sometimes you get information from the conversation you're having, and then when you do the movement test, you realize, no, wait a second, this doesn't match up. And then lastly, you may also need to use scans, but scans are usually not needed for this condition. You can usually make the diagnosis just through the in-depth conversation and the movement tests. But if there are other things that's just not as clear or making you think maybe there's something we need to rule out, a scan can be quite useful. Let's dive into each of these in more detail. So some of the clues we're looking for in the conversation we're having is, first of all, how does your symptoms feel? So typically for a tendinopathy, you're expecting the person to say that it feels painful or that it feels quite tight or stiff. Sometimes they have both those symptoms, but some people may just have pain, others may just have stiffness. If they're getting tingling or numbness or funny sensations in their leg, then that's a sign that there's actually a nerve irritated. Now, it may mean that it's a totally different injury, or it may actually mean that, no, they have got high hamstring tendinopathy, but a nerve is irritated in addition. And your physio will understand what tests to do to test for that, to understand what exactly is going on. Then it is also about where you're feeling these symptoms. Now, typically, the main pain with high hamstring tendinopathy is right in the sit bone. So right there where you would sit. If your main pain is more up here, that's likely going to be more a glute or back injury. Same for if your main pain is more in the back. It's also normal for high hamstring tendinopathy to have tightness and stiffness and a bit of pain into the hamstring muscles themselves. But if the pain is going below the knee, or especially if you've got numbness in the foot, then that's going to be more related to a back injury or nerve irritation usually. Like I said, it can be both of them at the same time, but it may also be that actually your diagnosis is not high hamstring tendinopathy. Another thing we're very interested in is to understand how your symptoms started. Typically, a tendinopathy will start slowly over time because it's an overload injury. If you had a sudden sharp pain or incident and then your pain was there, that usually means you've torn something, not a tendinopathy. So with a tendinopathy, it's either during a hard training session or a day of gardening or something like that, that suddenly towards the end of that, you start thinking, oh, that's becoming quite uncomfortable. But more typically, it's actually hours after you've done the activity, or even the next morning that you wake up and think, oof, what is going on there now? And then lastly, we want to understand how these symptoms react to different activities. Typically for a tendinopathy, they either have a delayed pain response, so you don't feel the pain immediately while you're doing it, but several hours later it becomes uncomfortable, more uncomfortable after you've done something. Or they feel really uncomfortable at the beginning of an activity, but then they warm up and it feels okay, like you can do your run and it's not too bad, but then if you push it that a little bit too far, the pain comes back and it can be a lot worse afterwards. So you've got that combination of sometimes the pain disappears, sometimes it comes back worse, and more commonly, it has a delayed pain response several hours later. And especially with stretching, that can be the effect. So any movement where you've got, let me just demonstrate this. So any activity where you bend over and you pull that hamstring tendon even tighter over the sit bone will be more aggravating than when you're upright. So that means that anything where you work down there, or where you do exercises like deadlifts, where that really pulls tight, or even a squat where that really pulls tight. Or if you're doing a typical hamstring stretch where you're sitting with your legs straight out in front and you're bending forwards, that can really irritate it. But like I said, often it doesn't feel painful in the moment. It's only several hours later that suddenly your pain flares up and feels much worse. And then, of course, there's sitting as well. So some people will find that if they sit for a short period of time, it can be really, really painful, while others can sit for a very long period of time before it even starts to hurt. Some may find that it only hurts if they sit on certain types of surfaces. It all just depends on how irritated that tendon is, and also the specific area of the tendon, whether that actually makes contact while you're sitting on it. If that's the injured part, then it's more likely to hurt. Okay, next we've got the different tests you can do to try and confirm whether it's high hamstring tendinopathy or not. The first thing you can do is, yes, you can press on the injured tendon and see if it hurts, but actually that's not a very accurate test because of how the tendons attaches to the sit bone. You may not be able to actually reach the part that's injured. And it will also be positive if the bursa is sore, for instance. So just because you're pressing on it, it doesn't hurt, it doesn't mean that it's not high hamstring tendinopathy. Now, the more accurate test that you can do is actually movement tests, where you move the tendon into specific areas or you contract the hamstring tendons or the hamstring muscles to see how that affects the tendons. And these are the tests we use for our online consultations as well, because just like I'm now going to demonstrate them in front of the camera for you, we can demonstrate them over video call and then observe the patient before performing them. There are 3 main tests that people use. There can be more and others, but these are the main ones that people use to diagnose this condition. And you want to usually start with ones that doesn't cause a lot of compression on the tendon, just because it can be so easy to flare it up. And then if you don't really elicit symptoms with those, you tend to move on to the ones that compresses the tendon a little bit more. So I'm going to run through them for you. The 3 tests we're going to look at are bridge variations, also deadlift variations or Romanian deadlift movement. And then lastly, we're going to look at a hip flexion test that you can do to really compress the tendon against the sit bone and see if it hurts there. Now, please remember that tendons don't always tell you in the moment that they're going to flare up and going to be painful later. So if your patient told you in their conversation that their tendon pain can really flare up with certain movements, keep that in the back of your mind and perhaps don't test it to the point where you actually elicit pain. Just get a good idea of their strength and their movement to the point where you think you've got it figured out. Because if you do too many tests in that first session, you can really flare it up. I will say from a patient's point of view, I'm really sorry, but even if the physio is really careful with how much they test and how they test it, it's not an exact science. You can't get it right perfectly, and you may likely get a flare-up of pain the next day. That pain will settle down quite quickly within a few days of giving it relative rest, and it is unfortunately part of the process of figuring out what exercises are correct or not. If you do get a painful flare-up, don't just ignore your physio and never go back to them. Tell your physio about that, because that will help them better understand your situation and better tailor your rehab exercises. Okay, that's a lot of talking, so let's move on to the first test. We're going to look at the bridge, and we're going to look at a bridge that doesn't put a lot of compression on the tendons, because it's the least likely to aggravate you. And this is a good place to start, especially with people who have really sensitive tendons or who doesn't do a lot of exercise, or maybe they've just had a long period of immobility or not really doing much, so they're not going to be that strong. If you have an athlete who is really strong and doesn't sound like they've got an irritable tendon, you can start with stronger versions of the bridge. But let's start with the basics. So for the basic bridge, you've got your feet quite close to your bum, because in this position, the hamstring's not going to work that much. It's actually going to be your glutes that does most of the work. And that's exactly what we want. So all you do is you tighten up your tummy, squeeze your bum gently, and just lift your bum off the floor. And honestly, you don't have to worry too much about where you feel things working. If you're lifting up, the muscles we want to work is working. What we just don't want to see is this going on, because then you're using your back muscles more. You just want to go to where your hips go pretty much straight. And all you're doing is observing, what do you feel? Now, for some people, that may already cause a bit of discomfort in that area. And that would mean that this is likely where we're going to start. We're not going to even continue testing in the bridges. If it doesn't cause any symptoms, you can make the bridge a bit harder. Now, there are plenty of ways to make it harder. One would be to move the feet further away. The further your feet is away from your bum, the more the hamstrings are going to work. So you may even lift up on your heels, which activates the hamstrings more, and see if that causes trouble. You can also go and do it on a single leg, or you can put a weight on there and do it up and down, or you can put your feet on a chair to do that. I have made a video in the past about bridge progressions. I'm going to link to that one so I don't make this video too long. If you want to know the harder versions of the bridges, go look at that one. But like I said, start with the basics to test it and see how that influences it and build up from there. Okay, so the Romanian deadlift can be a really useful movement to assess the high hamstring tendons, because what happens is you're going to bend your knees ever so slightly and then you're just going to hinge forward from the hips. And what's happening here is the hamstrings have to contract while you're bending your hips, so the tendons are being compressed gently against the sit bone. If they are injured, this movement very likely is going to hurt. And most people can only go to parallel if they've got really flexible hamstrings. If you're really tight, you may only be able to go to that position. Get the patient to do that, see how it feels. I find it useful to tell people to guide the movement with their hands to about there. Now, if that doesn't cause any trouble, you can make it harder. So you can hold something heavy because that will load the tendons more. You can also do it on a single leg. Then you've got a balance element coming in. If you don't want to, because being off balance can add an extra element. So I often get people to just have a hand on a wall first, and let's just see what the extra load is doing to it, rather than have the balance there. And then of course you can test it like that as well. So that can be a really useful one as well to do. And also what I will do is, if somebody has a really sensitive tendon, I may not get them to go all that way down. So often I use it to just see, say for instance, I've got a really, really painful tendon. I'll get them to just go to where they can start feeling it pulling. And we note how far the fingers are from the knee. And we use that as a measure to remeasure when they start to feel better. Because the other thing is, often with high hamstring tendon patients, they've had pain for such a long period of time that everything is super sensitive. And every sensation you feel in that area triggers the mind to think, oh, I can't do this movement because it's going to make it worse. And often I will get people to pause and just ask them, what is it that you're feeling? Is it pain or is it just a pulling sensation? And 9 times out of 10, it's just a pulling sensation. And it's just your system that's so hypervigilant that it's saying, no, we can't do it. We're feeling something there. And it's absolutely fine to feel something there. We just want to keep the discomfort we feel below a mild niggle. So, or a 3 out of 10 people sometimes talk about. So don't be frightened if you feel something. We need to understand what you're feeling so we can use that then as part of your rehab and slowly use that movement to improve it. But I will go into detail about that in the rehab videos and the treatment videos as well that I'll make in the future. Have a look. There's already some articles I've written about that, which I'll link to in the description of this video. The third test is the bent knee straight leg raise. Now, that's a contradiction. Let me demonstrate this to you. So normally, when people test the hamstring tendons, they will get you to lift a straight leg up into the air because that stretches the hamstring. Now, the problem with that is it tends to get the hamstring more at the bottom or in the muscle belly. Whereas if instead of that, you have your other leg straight first and you bend the leg you want to test up first, can you see that you're now already putting some stretch on the upper tendons, getting them into contact with the sit bone? And now you're straightening out your leg, which means you're pulling it even tighter, and you can even then pull back a little bit there. If the hamstring tendons are injured, usually this will cause them to feel uncomfortable. If you've got a band that you can put around your foot, you can even increase that more. Now, I am quite flexible. If you have tight hamstrings, you will not actually be able to get your legs straight. And that's absolutely fine. So what I would do is bring it into flexion so that you've got your knee into your chest, and then straighten it as far as it will go that your hamstrings allow. But try to keep your hands there, that you don't just do that when you straighten it. So that's where you want to get it. And that will usually tell you if the hamstring tendons are angry or not. Now, please remember, that is a test. It's something you do at the start to understand whether you've got high hamstring tendinopathy or not. It's not something you do as a treatment. And if you're going to test it every single day, it's like pressing on a bruise. You're just going to keep the pain going. So I often get patients with shoulder injuries that says, when I do this, it really hurts the shoulder. And guess what they're doing all day? They're doing this all day, and then it doesn't get time to calm down. That type of stretch is exactly the same thing for high hamstring tendinopathy. Don't go and test it every 2 seconds because it will just keep on irritating it. Okay, it's just a test you do for diagnosis. None of these tests are 100% accurate. That's why you can't just do one as a diagnostic test. You've got to do a couple and marry the results up with what you found out about the symptoms as well, and make sure that they match. Because if the symptoms don't match what you see in the testing, then it may actually be an indication that you need scans to further diagnose this. So scans can be really useful, especially if the diagnosis is not clear, but they're not always needed. Most of the time you can diagnose it, or experienced physio can diagnose it actually through really listening to how the symptoms are acting and marrying that up with the tests. The nice thing about the tests is also it doesn't tell you just about the diagnosis. It also tells me as a physio which exercises are most likely going to work for you, how sensitive your tendon is to certain positions, and what's the combination of rehab we are most likely to start with that won't flare you up. But like I said in the start, unfortunately, it's not always possible to create an exercise plan the first time around that 100% won't flare you up. It's quite common after you've done all these tests to have a bit of a flare-up the day after. If you experience that, tell your physio. It will help them make a better plan for you eventually.